If you've ever had a UTI, you know how debilitating and annoying and painful it can be. Did you know that there are some women who are prone to developing these infections on a regular basis? Not only is this disruptive to their quality of life, but in some cases, women can get really sick and end up septic in the hospital. Well, I don't want any of you to be suffering through any of this, and that's why today we're going to be discussing about recurrent urinary tract infections. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. If you're new to the channel, welcome. Here we talk about everything pelvic health, what can go wrong with it, and how can we fix it. So if you like what you see, don't forget to subscribe and share it with a friend. So let's start with what is a UTI, or a urinary tract infection. So UTI is when a bacteria, typically E. coli, can enter into the urinary tract, which can include the bladder, the urethra, or the kidneys, and causes infection or inflammation of this urinary tract. Now, as a result, women can complain of symptoms such as burning or pain with urination, discomfort. They talk about a lot of urinary urgency, frequency, feeling like they have to go all the time and not being able to control urine. For a lot of women, they may notice blood in the urine, something we call hematuria. Now, for a lot of my older patients, the symptoms may be a little bit more vague, and they may not have the typical burning discomfort, but they may have symptoms such as cloudy urine or foul-smelling urine, or just not feeling like themselves or not feeling well overall. Some women may notice that they have pain in their lower abdomen or in the pelvic area, and in cases where patients may have an infection of their kidneys, they may also notice pain in their mid-back, which is where the kidneys are situated. If you're somebody who's getting these infections on a regular basis, which is what we call recurrent urinary tract infection, that's when I would recommend seeing a specialist to talk about what exactly is going on. So the definition we use for recurrent urinary tract infection is 2 or more infections in a period of 6 months, or 3 or more infections in a year. A regular UTI, your primary care doctor or your OBGYN should be able to treat. But if you're getting recurrent urinary tract infections, that's when your PCP should be referring you to a specialist, a urogynecologist like myself or a female urologist, because we want to do some evaluation, make sure there's nothing else going on. Now, before we talk about the workup for recurrent urinary tract infections, let's talk about what are some common causes for infections. Number 1, incomplete bladder emptying. If you're somebody who's having difficulty emptying their bladder properly, you're at a higher risk to developing infections. Now, why would anyone have difficulty emptying their bladder? There could be a whole host of anatomical reasons, physiological reasons. Something that I see very commonly in my practice are patients who are suffering with pelvic organ prolapse, specifically the anterior wall prolapse or cystocele, where their bladder is pushing into the top vaginal wall, and as a result, the bladder anatomy is getting distorted, so they're not able to empty the urine collected in the bladder. And when the urine collects in that bladder and not emptying properly, women are more susceptible to developing infections. And also, when the residual urine is collecting in the bladder and they're not emptying properly, it becomes more difficult to clear the infection that they may have. Other conditions, such as any kind of neurological conditions that patient may be suffering with, because of which they're not emptying their bladder, other kinds of pelvic floor dysfunctions, such as a very tight pelvic floor. Number 2, hormonal changes. As women go through menopause, there's a decrease in their estrogen level, and we know that estrogen is very important to maintain the vaginal flora. So what the vaginal flora means is that our vagina is full of good bacteria known as lactobacillus. It helps maintain the pH of the vagina, but it's also protective and helps and prevents women from developing infections. As women go through menopause, with the decrease in their estrogen, that vaginal flora changes and we lose a lot of that good bacteria, and as a result, women can have an overgrowth of the bad bacteria, things like E. coli, that can go up to their urinary tract and cause infections. And it's not only the postmenopausal women who may notice increased risk of infection as a result of decreased estrogen. A lot of my patients who are recently postpartum, meaning they have just given birth and are breastfeeding or lactating, they also notice a decrease in the vaginal estrogen, and again making them more susceptible to infections. A lot of my young patients who may be on birth control pills, depending on what kind of birth control pills they're on, they may notice that there are changes to the vaginal estrogen level, which again can make them more susceptible to developing infections. Number 3, sexual activity. A lot of my patients notice that they have symptoms of a UTI, or they actually develop a UTI every time they have intercourse. And that's because, with the act of penetration, it can introduce bacteria into the urinary tract, making them more susceptible to developing these infections. Number 4, anatomical differences. Now, the urethra, which is the pipe through which urine comes out, usually is about 3 to 4 centimeters in most women. But some women may have an anatomically short urethra, which makes them more susceptible to develop infections. Number 5, patients with poorly controlled diabetes. Diabetes, when it's poorly controlled, it increases the sugar in your body, which is basically food for the bacteria. And again, those are patients who are susceptible to developing infections. Urinary catheter usage. A lot of patients may have to use a catheter either because they're having difficulty emptying their bladder, or maybe because they have recently had some sort of pelvic surgery or any other surgery because of which they need a catheter to be able to empty their bladder. Now, having a foreign object in your bladder can put you at a risk for developing infections because it can be a way for the bacteria to track up to your urinary bladder. Finally, poor hygiene practices. A lot of the times I may have patients who maybe because of their body habitus are not able to clean themselves appropriately, especially after a bowel movement. And so a lot of the bacteria, the E. coli, comes from our gut, and it can track up to the urinary tract, making women susceptible to developing infections. How do I evaluate a patient for recurrent urinary tract infections? If you're having an infection here and there once a year or very infrequently, then it's just okay to go to your primary care doctor or go to an urgent care. Make sure they test your urine, and then if appropriate, treat you with the right antibiotics. You don't necessarily need any further evaluation than that. But if you're somebody who's getting recurrent urinary tract infections, which, as I discussed before, is 2 or more infections in 6 months or 3 or more infections in a year, that should be a signal that you should probably see a specialist who can do some further evaluation, do appropriate workup, and treat you appropriately. Now, when I get a patient referred to my office for recurrent urinary tract infections, the first thing I do is start with a good history. And when I say history, I'm asking them how many times they've had infection. Are these infections that were tested appropriately? Meaning that somebody checked their urine culture to make sure that there is bacteria growing in that infection. Because a lot of the times women may have symptoms of an infection, meaning they have the burning, they have the discomfort, but when we go to check their urine culture, there's really no bacteria growing. Now, that's a whole other pathophysiology, and I'll make a separate video about that. But understand that a true UTI is when you have bacteria growing in your urine. So very, very important that a urine culture was done to document when and where you're having these infections. After a good history, I do a very thorough evaluation. So when I'm doing a pelvic exam, I'm looking for any kind of anatomical changes, things that can suggest that they have low estrogen, so signs such as vaginal atrophy, vaginal thinning, whether their vaginal tissue seems very friable or is it bleeding very easily. Do they have any signs of pelvic organ prolapse, or have they had any kind of surgeries done before? Is there any foreign object in that bladder area or in the pelvic area that could explain their infections? Once I've done a good thorough evaluation and we have demonstrated and they truly have recurrent UTI based on the definition, then we talk about what are some next steps. For a lot of my postmenopausal women, the first treatment options that we talk about is starting them on vaginal estrogen cream to help prevent future infections. Now, vaginal estrogen has been really well studied and has been shown to be hugely beneficial for my patients who are suffering with recurrent urinary tract infections. Now, a lot of the times, patients may be very scared to start estrogen because they have been told that estrogen can cause blood clots, it can cause breast cancer. So that is a conversation that I have with my patients. I reassure them that vaginal estrogen is very different than systemic estrogen. Because we apply it locally, the amount that gets absorbed in our blood is so low that it doesn't have a lot of the systemic side effects that patients are worried about. But it works locally, which is what we need to help prevent infections. Now, vaginal estrogen helps restore the vaginal flora to a good, healthy level. It can restore the vaginal pH and thus can help prevent infections. Then we talk about some supplements, such as cranberry supplements or D-mannose. So cranberry supplements is basically a cranberry extract. It's not just a cranberry juice, it's a concentrated form of cranberry that you patients can usually get from a health food store, and it should contain about 36 milligrams of a chemical called PAC, which is proanthocyanidins. And there are some studies that shows that cranberry supplements with 36 milligrams of PACs can help patients clear up the bacteria from their bladder. Similar to the cranberry supplement, D-mannose is a sugar supplement, makes it difficult for the bacteria to stick to the walls of the bladder, making it easier for them to be cleared out. Probiotics can be helpful. Again, there are not a lot of studies that shows a direct benefit, but there are some probiotics available that have lactobacillus in them. It can help restore some of that good bacteria for the vagina. Then also probiotics in general can help restore your gut bacteria, hopefully prevent infections. We talk about increasing hydration because the more you drink, the more you'll be able to go to the bathroom and be able to flush the bacteria that's already in your bladder. Hygiene, there are not a lot of good studies that shows a direct benefit, but if I have a patient that when during my exam I notice that there is some fecal soiling around their anal tract, I'll talk to them about using water after bowel movement to clear up some of that fecal material so that there's no cross-contamination. I usually recommend patients to just use those peri bottles, those squeezy bottles that you can get from the dollar store. Get some water from your tap and then use it to clean up after having a bowel movement, and then use just toilet paper to dab that area clean. In some cases, we do consider patients doing some antibiotic prophylaxis. What that means is, if I have a patient who have tried some of the other treatment options and they're still not being able to get rid of their infections, we start them on a low-dose antibiotic to take it on a daily basis for a period of 3 to 6 months. Now, I'll be honest, it's not my favorite option because what happens is when you put somebody on antibiotics for a long time, they're at risk for developing antibiotic resistance. So I'm not a big fan of it, but again, if needed, that is something to consider. For a lot of my patients, especially those women who notice that every time they have intercourse, they have an infection immediately after, I'll give them a prescription and tell them to take an antibiotic almost prophylactically, either before intercourse or immediately after, to help prevent an infection. But that's an individualized conversation based on your individual situation. Now, if I have a patient we have tried some of these measures and nothing is improving, then that's a patient that I want to do some further evaluation and some testing. There is a test that we do, it's called cystoscopy, where we look inside the bladder with a tiny camera. It's an office-based procedure, and the idea is it allows me, the physician, to look inside the urinary tract, inside their urethra, inside the bladder, make sure there's no anatomical reasons why they're having these infections, that there are no masses, there are no stones, God forbid there's no cancer that could be causing some of these symptoms. Also, we often do imaging of their kidneys and their upper urinary tract, either via a renal ultrasound or a CT scan, where we look at the kidneys, the ureters, the bladder, and again, that's to rule out any kind of masses or any stones or any other pathology that could explain why they're getting these infections that's not being treated. So if you're somebody who's suffering with recurrent urinary tract infections, start with talking to your primary care doctor. Make sure that you're getting a urine testing done every time you have your symptoms, because it's very important not just to do the quick test in the office, but also do a urine culture to see whether or not you have bacteria growing in your urine. If you're truly suffering with recurrent urinary tract infections, then have your primary care doctor give you a referral to see a specialist, because we can do a more thorough evaluation and do some appropriate testing to try to find out the etiology of why you're having this infection. Hope you found this video helpful, and if you did, you can also sign up for my newsletter for more helpful tips about your pelvic health. Hope to see you soon. Bye.